Welcome, friends and some new friends. Thank you for being here. I'm truly honored to be here with you all. I'm here to tell you we tried endlessly to save my son, and we would have continued to stand by his side forever. I don't imagine any greater grief than losing your child. When we couldn't provide him safety and security, we reached out from our loving families to seek professional guidance. Jordan was admitted to Markham Stouffville Hospital because he was suicidal. Dr. Tang was the attending psychiatrist. We begged him to listen, and we told him it was heroin. We swallowed big on our pride when we told him where it was. He said it was a personality issue. Was fentanyl laced heroin the size of a golf ball lodged in somebody's bowels not a concern in your hospital, in a medical facility? Why was intervention not given? Asking Jordan to cooperate when he was dope sick. Your judgment made you abuse your professionalism, and your lack of care put Jordan's life at risk and many others in a mental health unit. It's proven success that we stand by someone's side. Giving them the chance to trust you provides them much better results than trying to force someone into something by someone they don't know and they don't trust. Sent from Markham Stouffville Hospital to a holding cell for the night because Dr. Tang was off for the weekend. Is this how we treat somebody with a mental health crisis?
Shame!
Why was our information not carried on about the heroin after we swallowed such pride to tell you where it was? Why was there no report for a suicide watch? This lack of diligence could have risked more lives. And Dr. Tang, this is for you because your patient confidentiality, as is mine, only takes you as far as somebody else risking their lives or someone else's lives. Transferred to Lindsay Correctional Facility, no screening, no checks, and no suicide watch. And definitely no intervention. Jordan overdosed later that very day. They treated him with Narcan and sent him to the hospital as they're supposed to do. When he went back to the Lindsay jail, no 48-hour check or watch as per their policies on overdose. No suicide watch, no screening, and no intervention. The next day, Jordan was acting strange. He's a person who just had an overdose in your facility, has a seizure disorder, a brain injury, and is now in a mental health crisis. Why was a nurse not called? They tossed him in his cell, and when they found him barely clinging to his life, they chose to not give Narcan, knowing they did not give Narcan. They watched him die, knowing without Narcan, CPR would not be effective. They aided him to die. The guards claimed that they were aware of his health conditions, but they let him die. Being such a good citizen and living my life to uphold the law? Now you've killed my son. We must evolve our world to be a place led with compassion, empathy, and love for all mankind. 1 out of 5 people will experience mental health and addictions. We need to lower this number by providing appropriate resources for recovery, or to maintain a good quality of life. A good quality of life. Not a hotline with a 6 to 9 month waiting list. Not a negligence of not maintaining a court-ordered services for mentally ill patients that have been suffering for months with any services. This justice system isn't broken, friends. It was built this way, bound by policy and internal review. Justice for all those lives that have been lost, and my love and the deepest condolences to all of your families. Justice for basic necessities for all those suffering on the inside of this hell that they call a correctional facility. July 9th to July 17th, 15 people died in Toronto from overdose. Yet still I scream with thousands of other people to make the opioid crisis a national emergency. Justice for mental health, justice for Ijaz Chaudhry, justice for Pierre Courteau, justice for Solomon Farik, justice for Shane Spalding, justice for Abraham Mason, justice for Stephen Duffy, and justice for Ashley Smith, justice for all those who've lost life due to government negligence, justice for Jordan. Thank you.
Each other and making sure that families that go through this have their extended families, their extended communities, and the force of solidarity of people around them, because nobody can go through this alone. Is Hassan around? Oh, welcome. Thank you.
Justice for Ijaz!
Justice for Ijaz! Justice for Ijaz!
Justice for Ijaz!
Thank you.
We need the names of the officers! Justice for Ijaz! Justice for Ijaz!
Justice for Ijaz!
Justice for Ijaz!
Thank you. Assalamu alaikum, everyone. Good afternoon. First of all, I'd like to say thank you to Brother Yusuf and his family and all the organizers here that have given us the opportunity to speak. I'm very thankful for being given the platform to be able to speak up in regards to our family. And I want to thank you all as well for coming out. I know it's a Saturday, especially prime time. You know, this is time you spend with your family, time you do things, taking the time out and supporting